there's a delay for everybody between the time you start your therapy and the time that those cellular changes are starting to happen. And then there's another delay between the time that these cellular changes are occurring and that they show up in your life symptomatically or from a performance standpoint. There's also a delay between the time you stop the therapy and the peak of what benefits you're going to get. While any session has some benefit, depending on what you're trying to achieve, if you don't do some series of therapies over a period of time, you're really never going to get the benefits that you think you're going to get by spacing those sessions out so far. Another conversation that I like to have with people who say, I tried hyperbaric and it just didn't work for me, is what were you hoping was going to happen? And has really nothing changed, or the specific things you were looking for just haven't changed yet? And I bring that up because oftentimes patients have a list of 5 or 6 things that they're hoping hyperbaric will do for them. And it very well may, but we don't really get to choose which one is first, which one is second, or that I want the most important one first or the least important one last. How that shows up in your life, in your symptoms, in your overall quality or ability to do activities of daily living is where a lot of the variation lives. But if you've started to use it and you're not getting the results that you're looking for, my general advice would be stick with it a little longer, and or just make sure that the protocol you're following is appropriate for the goals that you have in mind.